Now with a segment on reproductive medicine, here's our reporter, Laura Windsor.
Advances in medicine now allow couples who have been experiencing fertility problems to have a baby. Dr. Paul Zarutskie of Mission Hospital in Mission Viejo explains how certain tests can evaluate the fertility of a couple.
Well, exciting area of medicine. The old phrase used to say we make babies. In vitro fertilization, infertility care. Our field crosses many barriers: scientific barriers, emotional barriers, religious and ethical barriers. They're all very complex, and what we've learned over the years is people are individuals, and we try to address these individual needs based upon societal norms. Society defines ethics and morals, and ethics is this concept of what we consider right and wrong. So within our field, we look at what our society accepts as right and wrong and work within those limits. Couple is trying to get pregnant. Many patients don't realize they can't get pregnant until they see a specialist or even a generalist in their care. Big issue for couples is often time goes by before they realize they can't get pregnant, because in our society we just expect we can have a baby when we want to. And so a lot of times 6 months to a year goes by, and in today's world with the internet, patients get on the internet and say, want to have a baby. And they start realizing they need to look at three things. Is the guy making sperm? So a lot of times they'll see a generalist and say, we're trying to get pregnant, help us out here. And so the sperm count becomes the first focus from the male side. From the female side, it's the ovulation. Is she making an egg? And is it a good egg? So that question becomes one about basically gynecological history. What have you done ovulation-wise? Do you have regular periods? Then the third piece is the connection between sperm and eggs, and I jokingly call it the roadway, but how do you get the sperm and eggs together? And that's the female reproductive tract. And we have some very simple tests that can be done, and also some very complex tests to address the question, is the roadway open? Can you get the sperm to the egg? Our field today is doing incredibly well versus when I was a student back in the 70s. Back then, almost half the people that came to us had what we called infertility of unknown reasons. We couldn't assess how well a sperm worked. We could count them, but we couldn't see how they worked, where today we can. So with issues like that, if you asked me this question 20 years ago, I would say we're not very good. We were averaging 5 to 10% pregnancy rates back in the 70s. Now, with some advanced technologies, we can get a 50% per cycle pregnancy rate. In nature, in the best situation, unassisted, it's about a 20% chance of a pregnancy. As subspecialists, we have some tremendous tools to help a couple get pregnant. We can look at sperm now and analyze whether they work. Can they rotate and move correctly? Can they penetrate a membrane of an egg? We can ask the question and answer it, what kind of eggs are a woman producing? We can do hormone tests, we can do ultrasound evaluations, and we can do evaluations in the dish where we can actually assess the quality of the embryos. By doing that, we've moved our science so far forward, because in the past, as I mentioned, we were very poor at predicting who could get pregnant and who couldn't. Now we're down to less than 10% of people having infertility of unknown reasons. This field is all about life, and it is such a rewarding field to take a couple who's desperately tried to get pregnant. Most recently, we have a couple who's lost 3 children in a tragic car accident, to come back and be able to see their life restarted and be able to reestablish the joys of having family are just incredible.
The chances of conception decrease with age, but advances are helping more women conceive successfully, bringing a gift of new life to a family. I'm Laura Windsor for the American Health Journal.